Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'll be speaking with Dr. Doug Iliff of Topeka about spreading infections. Thank you for being here today, Dr. Iliff.
You're welcome, Amy.
What sorts of things can we do in our everyday lives to help prevent spreading infections?
Well, I think the first thing to realize is that it's easy to spread infection. Fomites are surfaces that carry infectious disease, viruses, bacteria, fungi. That includes our hands, a table, your iPad, everything around us, toilet seats, doorknobs, steering wheels, and you can't get away from those sorts of things. And different viruses will live on surfaces for different lengths of time. You can sterilize those things, but they'll get infected again, and then you can carry them to your mouth or eyes or nose.
So do things like hand sanitizers help?
Hand sanitizers would help. There's no reason to go crazy with them, because no matter what you put on your hands will get infected again within a few minutes or a little bit longer. There's only one surefire way to keep from passing on fomite carried infections, and that's to put a paper bag over your head. And that will keep you from ever touching your mouth, your eyes, or your nose. Now, children touch their face on average about 10 times an hour. So good luck with that.
What about coughing and sneezing?
Well, coughing and sneezing, and of course breathing. And don't forget about breathing. For that, we have masks. When you see the Japanese dealing with the SARS epidemic in a closely compacted society, they're all wearing masks. And that, of course, is the best way to keep from spreading droplet-carried infections. The problem is that a cough or a sneeze will propel droplets at 20 meters per second for up to 10 feet, and even just normal breathing will carry on 4 feet, and you don't know who is infected when they're sitting next to you in church.
So you sound a little pessimistic. What kinds of things can we do about that?
Well, you know, I think that we just have to be reasonable about these things. We ought to wash our hands before we eat. We ought to do that, the sort of things that Mother always taught us. However, picture a world where everyone grew in a bubble for the first 30 years of their life and then emerged. Well, they'd be sick all the time. It'd be like a new kindergarten teacher. Now, I'm a physician. I'm exposed to disease every day. I haven't been sick in 15 years. It's because I've got great antibody protection. So you have to be reasonable. Getting infected and building up antibodies is a good thing. Okay,
great. Well, thanks for being our guest today, Dr. Iliff. Appreciate you being here. And please join us next week for a new health topic discussion on House Calls.